Hello, this is Rex Taylor from StopMyShoulderPain.com, and today I wanted to discuss a topic which is very controversial in the area of frozen shoulder and frozen shoulder treatment. I'm speaking particularly about a frozen shoulder manipulation. Of all the treatment options available for a stiff arm, a frozen shoulder manipulation is the one that is feared the most by patients with this condition. As a clinician, I'm often asked if this will cure the symptoms. And most of the time I quickly reply, well, it depends. The consensus among most medical professionals is that aside from surgery, a manipulation should be one of the last courses of action. To begin with, even though it is a closed procedure, this means non-surgical, a manipulation under anesthesia is traumatic to the shoulder's joint capsule and soft tissue structures in and around the shoulder complex. In theory, the clinician is trying to break loose adhesions that have formed around the joint capsule, thereby freeing up the motion in the shoulder. What happens in some cases, though, is actual tearing of the joint capsule itself. Motion is restored, but as the body begins to repair the area, it lays down more scar tissue, which can potentially cause more loss of motion and pain. This means the patient must undergo additional physical therapy to prevent further loss of motion. When considering to undergo this type of treatment, the patient must also account for other factors which prevent a manipulation from the best course of action. For instance, if the patient has a history of osteoporosis, there's an increased risk of sustaining a fracture as the arm is carried through various ranges of motion. Also, because of the sudden high velocity stretching, there's a small risk of developing a brachial plexus nerve injury, which is essentially an injury to the nerves that pass through the shoulder. Even rotator cuff tears have been documented after a procedure such as this. A skilled orthopedic physician specializing in disorders of the upper extremity can determine a patient's risk for the above. After the procedure is performed, physical therapy must be initiated immediately, as soon as day one after the manipulation, in order to maintain any motion that was restored. Ideally, the patient should attend PT daily for the first week to control swelling and prevent further loss of motion. As you can see, a frozen shoulder manipulation is a serious consideration and should be done only after conservative measures fail. Adhesive capsulitis treatment requires persistence, patience, and dedication to achieve full and productive range of motion and function. Treating a frozen shoulder early can mean the difference between regaining full use of the arm in a relatively short period of time versus experiencing symptoms and dysfunction that may last for years. I sincerely hope you enjoyed and benefited from this short video. You can learn how to stop your shoulder pain once and for all by visiting StopMyShoulderPain.com.